Thank you all very much for inviting me here today. My name is Melanie Combs Dyer, and I'm the Deputy Director of the Provider Compliance Group at the Centers for Medicare and Medicaid Services, CMS. And I'm here today to talk to you about a really exciting new demonstration program that's going to be starting soon. We call it the Prior Authorization of Power Mobility Devices Demonstration. And before I get too far into this, I want to review with you a few acronyms that I'm going to be using today. Power Mobility Devices is PMD. Durable Medical Equipment is DME. And I oftentimes refer to our Medicare administrative contractors as MACs. Now, the first thing to understand about the demonstration is which items are going to be included in the demonstration. And we've posted to our website a list of the codes, the items that are included in the demonstration. You can find our website at go.cms.gov/PA-demo, and the P and the A are capitalized. Included in the demonstration are all power-operated vehicles, all standard power wheelchairs, all Group 2 complex rehab power wheelchairs, all Group 3 complex rehab power wheelchairs without power options, all pediatric wheelchairs, and all miscellaneous power wheelchairs. Not included in the demonstration are Group 3 complex rehab power wheelchairs with power options. Again, you can find this full list and all the specific codes associated with each one at our website. Now, a question that I oftentimes get is, how will the coverage rules be different in this prior authorization program compared to how they are today? And the answer is, there's no change. Power mobility devices are going to be covered under the prior authorization demonstration exactly the same way that they're covered today. We are not changing the coverage rules at all. Nor are we changing any of the documentation requirements. We're still going to require the same documentation that we've always required. It's just that now the documentation will be submitted earlier in the process. Instead of waiting until the item is delivered to the beneficiary and then submitting a claim and waiting for the DME MAC to send a request for documentation, now the physician or supplier will be able to send the documentation in advance before the item is even delivered to the beneficiary and receive an answer back and find out, is this power mobility device covered for this beneficiary or is it not? And after they have that information, they can decide whether they want to deliver the item to the beneficiary and submit a claim and have it paid by Medicare, or deliver the item to the beneficiary where the beneficiary agrees to pay for it and not bill Medicare, or deliver the item to the beneficiary, submit a claim to Medicare, have Medicare deny the claim, and then they can submit the claim to a secondary insurance company. In the past, suppliers and physicians didn't have that option of finding out whether or not it was covered before delivering the item to the beneficiary. Now, under this demonstration, they will have the ability to do that. In addition, the advanced beneficiary notice procedures are going to remain exactly the same. Those advanced beneficiary notice procedures are the paperwork that a beneficiary can sign saying, I understand that Medicare is not going to cover this, and I, the beneficiary, accept financial responsibility. I'll pay for it. All of those rules are going to stay exactly the same under the demonstration. For those of you who want more information about the very specific coverage requirements, you can go to the DME MAC website and you can find all of those coverage requirements spelled out, along with all the documentation and advanced beneficiary notice requirements. A lot of people ask, well, when is the demonstration going to start? CMS has not yet announced a start date, but we will be publishing a Federal Register notice at least 30 days prior to the start date. So everyone will be able to look in the Federal Register and see when the prior authorization demonstration is going to begin. In addition, we'll be posting that information to our website, go.cms.gov/PA-demo. And we're going to be sending certified letters to all suppliers who have provided a power mobility device to a beneficiary in one of the prior authorization states. And we're going to be sending a certified letter to all physicians who have ordered a power mobility device for a beneficiary residing in one of the 7 prior authorization states. Those letters will also be going out about 30 days in advance of the demonstration. It's also important to recognize that the start date is going to be the same for all of the states in the demonstration program. I'll be out doing lots of education, and so will the DME MACs. We'll be trying to make sure that all the physicians and all the suppliers really understand the rules and they know exactly what paperwork has to be submitted when. The demonstration will be ending 3 years after it begins. So, where will the demonstration be occurring? Well, CMS has identified 7 states where we're going to be conducting the demonstration. We'll be doing the demonstration in New York, North Carolina, Florida, Texas, California, Illinois, and Michigan. And we chose those states because that's where there's a lot of fraud and abuse of these power mobility devices in the Medicare program. It's also important to remember that these states, where the demonstration occurs is going to be based on the beneficiary's residence. So we're not talking about suppliers who are located in these 7 states. We're not talking about physicians who are located in one of these 7 states. We're talking about beneficiaries who reside in one of these 7 states. And for those beneficiaries that may have 2 addresses, they live part of the year in Florida and part of the year in some cold part of the country, it's whatever address they have on file with the Social Security Administration. It's the same rules that the DME suppliers have used for many years in terms of determining which DME MAC they have to submit their claims to. They have to look at the beneficiary's address, and it's the same address that will drive whether or not this prior authorization program applies to those beneficiaries. There are 3 really important pieces of documentation that have always been required for coverage of a power mobility device. And those same 3 pieces of documentation are going to be critical in the prior authorization demonstration. They are the face-to-face examination documentation. Usually that's in the form of a progress note that the physician writes in the medical record. That's always been documented by the physician, and that will continue to be documented by the physician during that face-to-face examination. Number 2 is a 7-element order. The physician has always been required to write the 7-element order, and we'll be talking more in a later slide about exactly what has to be included in that 7-element order and in the face-to-face examination progress note. The third piece of documentation is one that is written by the supplier, and that is the detailed product description. That is where the supplier will look at the physician's 7-element order and perhaps look at the face-to-face examination documentation and determine exactly which kind of wheelchair, which kind of scooter, what kind of PMD the patient needs, and write that detailed product description and send it back to the physician. So those are the 3 critical pieces of information. Fourth would be any other documentation that either the supplier or the physician would like to submit, but those 3 are the most critical ones. And we're not changing in this demonstration at all who creates the documentation. It's still the physician that has to create the face-to-face exam progress note. It's still the physician that has to document the 7-element order, and it's still the supplier that has to create the detailed product description. What is changing in this demonstration is who submits that documentation and when. Now, in the prior authorization states, once the prior authorization demonstration begins, those 3 pieces of documentation can be sent by either the physician or the supplier. Again, only the physician is creating the face-to-face exam documentation, and only the physician is creating the 7-element order, and only the supplier is creating the detailed product description, but either one of them can gather up all the documentation and submit the prior authorization request. So a question I oftentimes get is, how long will the DME MAC have to make their decision? Once they receive that prior authorization request from either the physician or from the supplier, it has all the attached documentation. How long does the DME MAC have to make their decision? Well, the DME MAC will have 10 business days to make their decision, write out a letter to the physician, to the supplier, and to the beneficiary, and get those letters postmarked by the U.S. Postal Service. So 10 business days from the time they receive the request until the time they postmark the letters. That letter will say either we affirm or we non-affirm this prior authorization request. We either agree that all of the coverage requirements are met, we give you a thumbs up, or not all the coverage requirements were met, a thumbs down, a non-affirmative determination. One of those two decisions will be in the letter that comes in 10 days. If it is a non-affirmative decision that's made by the DME MAC, they will detail in their letter exactly what coverage criteria was not met or exactly what documentation was missing. That way, the supplier or the physician or the beneficiary will understand what went wrong with the prior authorization request. Why is this item not covered for this particular beneficiary? Now, if a physician or supplier receives a non-affirmative decision from the DME MAC, they can submit a second request. And they can submit an unlimited number of resubmissions. It's important to realize, though, that the normal timelines continue to apply for the face-to-face examination and for the order. So we encourage suppliers and physicians not to dally, but instead to submit as much information as they can with their initial request, try as hard as they can to get an affirmative decision right up front. And if they do receive a non-affirmative decision, again, very quickly try to gather up the missing pieces of information and resubmit the request as quickly as possible. We encourage all power mobility device suppliers to wait until they get their prior authorization determination from the DME MAC before they deliver the item to the beneficiary and before they submit their claim to the Medicare program. Now, in rare circumstances, the beneficiary might have a medical condition that requires them to have their PMD faster than in 10 days. In those situations, we will require the DME MAC to make the prior authorization decision within 48 hours, not 10 days. We don't expect those situations to occur very often, but we just wanted everyone to know that we do have that in place in case of medical emergencies. Now, those three very important pieces of documentation that I referred to earlier, the face-to-face exam progress note by the physician, the 7-element order documented by the physician, and the detailed product description documented by the supplier, these three very important pieces of information we're going to discuss a little bit more. I have a video to show you. This is Doris Jackson. She's a health insurance specialist here at CMS, and she'll tell you a little bit more about each one of these very important documents. Here's the video.
Hello, my name is Doris Jackson. I'm the health insurance specialist within the Division of Medical Review and Education at the Centers for Medicare and Medicaid Services. I provide oversight to the Medicare administrative contractors for durable medical equipment to ensure that payment is made only for services that meet all Medicare coverage, coding, and medical necessity requirements. Today, I'll be discussing the documentation requirements for physicians or treating practitioners when submitting a prior authorization request for power mobility devices. First, I would like to share that the documentation for power mobility devices has not changed. The current local coverage determination policy explains thoroughly what documentation CMS requires for payment approval. The physician, treating practitioner, and the supplier Each play a vital role in facilitating that Medicare beneficiaries receive the correct paramobility device. The physician or treating practitioner is required to conduct the face-to-face examination. This examination must be an in-person visit with the ordering physician or treating practitioner and clearly states the beneficiary's mobility limitations and needs. The face-to-face examination must include a statement indicating the purpose of the visit. For example, the physician must document the patient is present for a mobility examination or the patient is requesting a power wheelchair. The face-to-face examination must also include present medical condition and relevant past medical history. The medical history may include symptoms that limit ambulation, diagnoses that are responsible for symptoms, medication or other treatment for symptoms, progression of ambulation difficulty over time, other diagnoses that may relate to ambulatory problems, distant patient can walk without stopping, pace of ambulation, ambulation assistance currently used, change in condition that requires a PMD, and description of home setting and the ability to perform activities of daily living in the home. The physical examination portion of the face-to-face exam should focus on the body systems that are responsible for the patient's ambulatory difficulty or impact the patient's ambulatory ability. Review of the systems may include the following assessment: height and weight, cardiopulmonary examination, musculoskeletal examination, which will include arm and leg strength and range of motion, and neurological examination, which may include gait, balance, and coordination. Please note, not all elements identified may apply to every patient. Professional discretion is necessary to determine which items are required as part of the face-to-face examination. In addition to the face-to-face examination, the physician or treating practitioner must also write a valid 7-element order for the power mobility device only after conducting the face-to-face examination. The 7-element order must include: number 1, the patient's name; number 2, description of the item to be ordered. Typically, this is written generally. The physician may write something as simple as power-operated vehicle, power wheelchair, or something more specific. The supplier is responsible for reviewing the description of the item to be ordered, then must complete a detailed product description, which must be reviewed and signed by the physician or treating practitioner. The detailed product description must contain the following information: the specific healthcare common procedure coding system codes, a narrative description of the items or manufacturer's name and model number, the physician's signature and date signed, and date stamped to document receipt date. The other requirements for the 7-element orders are as follows: number 3, date of the face-to-face examination; number 4, diagnoses or medical conditions related to the need for the PMD; number 5, length of need; number 6, physician or treating practitioner signature; and number 7, date of physician or treating practitioner signature. Documentation in the patient's medical record should paint a picture of the patient's functional abilities and limitations on a typical day. It should contain as much objective data as possible. The physician or treating practitioner's documentation should support the medical necessity for the use of the power mobility device in the beneficiary's home.
Now let's talk about a few of the potential problems that could come up when a supplier submits a prior authorization request to the DME MAC. If the letter that a supplier receives back or a physician receives back from the DME MAC says that the prior authorization is being non-affirmed because the order was written before the face-to-face exam, well, the solution to that is to have the physician write a new order and then a new prior authorization request can be submitted. If the problem that is described in the letter is that more than 45 days went by between the face-to-face exam and the written order, then the physician needs to conduct a new face-to-face exam, write a new order, and then submit a new request. If the letter says that the prior authorization request is being non-affirmed because there was an element that was missing from that 7-element order, the solution is to have the physician write a new order that contains all 7 elements and submit a new request. If the problem is that the coverage criteria were not met, you need to remember that DME is covered by the Medicare program only for use in the patient's home. And the physician may need to conduct another face-to-face exam and fully document this time in the progress note all of the reasons why the patient needs to have the power mobility device in their home. They can't get from their bed to the kitchen. They can't get from the living room to the bathroom without a power mobility device. They can't conduct their normal activities of daily living without a power mobility device. Once they've conducted that second face-to-face exam, they can then resubmit a request, prior authorization request to the DME MAC. And if the letter says that the prior authorization of the power mobility device is non-affirmed because the face-to-face exam was incomplete, then again the physician may need to conduct a second face-to-face exam, this time fully documenting everything in that face-to-face exam, and then a new prior authorization request can be submitted. So next, let's talk about resubmissions and appeals. Resubmissions occur whenever a physician or a supplier has received a non-affirmative prior authorization determination in the mail. They've submitted their prior authorization request and they've gotten back a negative decision, a non-affirmative decision. In that case, the supplier or physician is not appealing the determination. They are resubmitting their request for prior authorization decision. And they can submit an unlimited number of times. They're not called appeals, they're called resubmissions. Once they receive a decision, a prior authorization determination, they can then submit a claim to Medicare. And as usual, any claim that is denied by Medicare can always be appealed. So non-affirmative prior authorization requests can be resubmitted. Denied claims can be appealed. Now let's go through a couple of scenarios. Let's talk about 4 common scenarios that we're expecting to occur. The first scenario is where the supplier or the physician submits a prior authorization request. They include the 3 pieces of documentation that we've talked about. And the DME MAC receives it and makes an affirmative decision. The DME MAC sends a letter and says, thumbs up, all the coverage requirements are met. In that scenario, the supplier can provide the information, provide the item to the patient, deliver the item, the PMD, to the patient's home, and then submit a claim. And so long as all the other coverage requirements are met, that claim will be paid almost automatically. Scenario 2 occurs when the supplier or the physician submits a prior authorization request, but they receive a non-affirmative decision. The DME MAC gives them a thumbs down and says, nope, we don't approve your prior authorization request. In that situation, the supplier and the physician have a choice. Are they going to try to make it right and get back up into scenario 1 where they get the thumbs up and they get they can deliver the item and they can have their claim paid? Or do they want to receive a claim denial from Medicare? Sometimes they might want a claim denial because they've got a secondary insurance company that they want to bill, but the secondary insurance company will only pay once Medicare denies a claim. So if they decide that they really want the denial, the supplier will, even though they got a non-affirmative prior authorization determination, they'll go ahead and deliver the item to the beneficiary, submit a claim to Medicare, including on that claim the prior authorization number that came on that letter saying it's non-affirmed. And once that claim has been received by the DME MAC, it will be denied. And then the supplier can use that information to submit to their the beneficiary's secondary insurance company. Scenario 3 and 4 occur when the supplier and physician choose not to go through the prior authorization process. They decide to skip prior authorization. Well, in those situations, of course, the DME MAC is not making an affirmative or a non-affirmative decision prior to delivery. The supplier goes ahead and delivers the item to the beneficiary's home. And at that point, what happens next depends on whether or not the supplier is a competitive bid supplier or a non-competitive bid supplier. If you're a competitive bid supplier and you don't go through prior authorization, you skip it altogether, and you submit your claim to Medicare, Medicare is going to stop the claim and develop it. By develop, I mean the DME MAC sends you a letter and says, "Dear supplier, you've been chosen for review. Please send me the 3 important documents and any other documentation you want to send, and I'll review it and let you know whether or not it's covered." The supplier has 45 days to send in the documentation, and the DME MAC has 60 days to make the decision. If the DME MAC determines that it is a payable claim, the coverage requirements are met, then the claim will be paid at the normal rate. Whatever the competitive bid contract says, that's how it will be paid. On the other hand, if it is a non-competitive bid supplier who skipped the prior authorization process, they didn't get an affirmative or a non-affirmative decision from the DME MAC, they choose to deliver the item to the beneficiary and submit a claim to Medicare, in that case, then the claim will be developed by the DME MAC. A letter will go to the supplier. "Dear supplier, you've been selected for review. Please send me the documentation." Supplier has 45 days to send in the documentation, and then the DME MAC has 60 days to make their decision. If the DME MAC decides that all the coverage criteria are met, the patient does need the PMD, it is covered by the Medicare program, they'll mark it as a payable claim, but it will be paid with a 25% penalty. It will be paid at 75% of the fee schedule amount. So again, prior authorization is not mandatory. Suppliers can still skip it if they want to, but if they do, they will be penalized by having to go through the development process, 45 days to send in the documentation, 60 days for a decision. And if they're a non-competitive bid supplier, they'll also have a 25% payment reduction taken at the time of claims payment. Next, let's talk about the physicians who say, well, if I'm going to be submitting this prior authorization request, gathering up this paper and faxing it in or mailing it in or electronically submitting it through the electronic submission of medical documentation process, that's extra work for me. Is Medicare going to pay me any additional money for the extra work it takes to gather up these documents and send them in? The answer is yes. If a physician chooses to be the submitter of the prior authorization request, they can bill a specific G code, G9156, and Medicare will pay a small amount for the time that was spent in gathering up the additional documentation and sending it in. Of course, the time that was spent writing out the face-to-face examination progress note and the time spent writing the 7-element order, all that work is included in their visit payment that they would normally get. We're talking about extra work to submit the prior authorization request. The physician will get a G-code payment for that. At least it partially compensates the physician or the practitioner for the additional time that they spend gathering up that paperwork. So what about the impact on the beneficiary? How will the prior authorization program affect beneficiaries? We think that the impact on beneficiaries will be fairly minimal in terms of the paperwork in advance. The beneficiary is not expected to have to file any additional paperwork. That will be the supplier or the physician. And the coverage requirements aren't changing. Whatever was covered for a beneficiary before for power mobility devices, the same coverage rules are going to apply. So if they qualified before the demonstration, they'll qualify after the demonstration. What will be different is that the beneficiaries may receive a letter in the mail telling them about the prior authorization decision. And so you, the supplier, may need to give the beneficiary a heads up and just let them know that they can be expecting to receive that letter in the mail. And of course, CMS always encourages beneficiaries to use suppliers who accept assignment. So, in summary, this is a demonstration, the prior authorization of PMD demonstration that will be operating in 7 states. It's beneficiaries who reside in California, Illinois, Michigan, New York, North Carolina, Florida, and Texas. It's a demonstration that will begin for power mobility device orders, 7-element orders, that are signed on or after the start date. And as of today, the start date has not yet been announced, but we will be announcing it in the Federal Register sometime this summer. The prior authorization request can be submitted by either the physician or treating practitioner or by the supplier. Either one can submit the prior authorization request to the DME MAC. And the demonstration program will stop 3 years after the start date. It's a 3-year-long demonstration. Now, if you'd like to get more information about the prior authorization of power mobility device demonstration, you can send us an email, particularly if you have questions that are not addressed by my presentation here today or are not answered during the Q&A that we'll be having momentarily. You can send those questions to pademo@cms.hhs.gov. That's the email address that you can use to send us questions or suggestions for improvement. pademo@cms.hhs.gov. And if you'd like to go to our website to see information, a list of codes, a reminder, a copy of these slides, it's go.cms.gov/pademo, where the P and the A are capitalized. go.cms.gov/P, demo. You can also check out our frequently asked questions page. You can see the questions that people have asked before you and our answers. That's https://questions.cms.hhs.gov/app/home. And you can type in keyword PMD and you'll see all the questions that have come before you. You can follow us on Twitter at #PMD_demonstration. Or we're soon going to have a way that you can sign up to receive broadcast emails. We'll have more information about that posted to our website. We also encourage you to check out the website of our DME MACs. They're the normal URLs that you would normally use to contact the DME MACs. And you can find links to each of their websites from our website. And at this point, I'd like to stop and ask if there are any questions from the audience. Yes, ma'am. Could you please use the microphone?
Thank you, Melanie, for an amazing presentation. I just have a question. What criteria will CMS use to determine whether the power mobility device is reasonable and necessary?
So the question has to do with the criteria that the DME MACs are going to be using to make their determinations about whether or not a particular a PMD is covered for a beneficiary. And it's the same criteria that we've always used. It's all spelled out in the National Coverage Determination, the NCD, and the local coverage determination, the LCD. You can find copies of the NCD and LCD at www.cms.gov/MCD, like Medicare Coverage Database. That Medicare Coverage Database has all the national policies and all the local policies, and you can go there and you can read about the criteria. The most important criteria, the place that we see oftentimes physicians and suppliers make a mistake, is in forgetting that the power mobility device demonstration, the power mobility device benefit in Medicare is limited to patients who need to have the equipment in their home. If a patient needs the equipment in their home, they need to get from the living room to the bathroom. They can't do that without a power mobility device, and that's documented in the patient's medical record, then it's covered. But if they don't need help within their home to ambulate, to move around, to get to the kitchen and the bathroom, they only need it when they need to go to the doctor's office or to go on vacation, then it would not be covered. Obviously, if they qualify for in-the-home use, they can certainly take the power mobility device anywhere, to the grocery store, to the doctor's office, to vacation. But they first have to meet that in-the-home criteria first before they can be covered by Medicare and take it outside the home. Other questions? Sure. Come down, please use the microphone.
Is there a specific list of medical conditions that would warrant the use of a power mobility device?
Good question. Thank you. The question is, are there specific conditions that would qualify a patient for PMD? And the answer is no. There are lots of different types of conditions that could cause a beneficiary to not be able to perform their activities of daily living in their home and need a power mobility device to help them move from one room to another. And so no, there is no specific list of conditions. The physician has to document, or the treating practitioner has to document in the patient's medical record why it is that they cannot conduct their mobility-related activities of daily living without a power mobility device, why a walker won't work, or why a manual wheelchair won't work for their condition. And so long as that's documented in their medical record and the other criteria are met, then it will be covered for them. Next question. Yes, sir.
Is the power mobility device fraud and abuse problem fairly well contained within the 7 target states, or do you expect CMS to expand the program into other states?
That's another great question. The question is the fraud and abuse problem limited to just the 7 states that CMS picked, and we're never going to expand this demonstration? Or is there fraud and abuse that's occurring in other states and CMS might expand someday? And it's the latter. We chose these 7 states because this is where we see the most fraud and abuse. It's in these 7 states. However, we do recognize that there is some fraud and abuse that does occur in other states. And so we'll be evaluating this demonstration as we go through. And if we determine that it's appropriate to expand the demonstration to other states at some point in the future, we'll certainly do that. Thank you. Any other questions? Oh, right here.
How will the prior authorization program be administered for power mobility devices, and will you devote specialized staff to the program?
So the question is, how are you going to do this, and are we going to have specially trained staff that is making the decisions about each prior authorization request? We're going to be operating the power mobility device demonstration through our DME MACs, our Durable Medical Equipment Medicare Administrative Contractors. These are the contractors who are the ones today that accept the claims. It's where suppliers send their claims today. The same companies that you're submitting your claims to today, they're the ones who will be running the prior authorization program and making the decisions. And they will be using highly trained staff, experienced staff who have been making these decisions about Medicare coverage of PMD devices for years. They will be using those staff to make these prior authorization determinations. So really good, highly qualified staff making the decisions. Thank you. Any other questions? Right here.
How can 43% of claims be considered a demonstration project? Isn't a demonstration project limited to a small percentage of claims?
So the question is, the 7 states that we've chosen in which to perform this demonstration account for 43% of the payout each year for power mobility devices. And isn't that pretty big? Doesn't that sound like it's too big to be a demonstration? Shouldn't we have limited this to a smaller number of states? We really struggled with that, trying to figure out what the right number is. We wanted to choose more than one state. We wanted to choose the states where we were seeing the largest amount of fraud and abuse. And we wanted to make sure that we were picking enough states that we could really try to show that we were having some bang for our buck. And so that's why we chose these 7 states. Even though they do represent 43% of the payment, we think it's a good size demonstration, and we'll see as we go through it whether or not we need to expand into other states. Any other questions? All right, well, seeing none, thank you all very much for inviting me here today. I hope you've learned a lot about the prior authorization of power mobility device demonstration that CMS will be starting soon. And remember, if you need any other information, you can go to our website. That's go.cms.gov/P, A, demo. Thank you very much.